today's video, I'm going to be demonstrating how to do a proper sterile wound irrigation and dressing change. So for the point of this video, I don't have any tables high enough or enough tables that are high enough, so I have to use two side tables and a chair, unfortunately. But during a proper procedure, I would make sure I have a table that is at my waist height. For the procedure, I would also raise the bed up to not, hurt my back. So the first thing that I would do before I even got started is I would double check that the patient's chart. I would check for any kind of PRN pain medication. I would also check for how long has the wound happened, like if there's stitches, is it a surgical wound, any kind of indication on any information I can get about the wound prior to going in there. And then the next thing that I would do is I would go into the patient's room, introduce myself. Hi, my name is Matthew Simek. I'm going to be your student nurse today. It's nice to meet you. I would double check the patient's armband again, name, date of birth, like John Smith, 1999. And then I would ask how they were feeling today. I would ask them to assess their pain and then inform them that I was about to do a dressing change. And if they were feeling okay, they weren't in any kind of pain, I would go ahead and go gather my supplies. If they were in pain, then I would stop, go look at my PRN med orders, just double check, make sure the patient was due for any kind of pain medication, and then I would administer that and give it a bit to kick in. So after all of that, I would gather up all my supplies, which I have on my chair over here. Gather up all the supplies, go into the patient room, check the armband again, and then I would perform proper hand hygiene, and then I would get started. So the first thing I would do is, obviously I would wash my hands before this. I would get my gloves, my clean gloves. These are and then I would go over to the patient, kind of explain step by step. For this process, what I'm going to be doing is looking at the dressing that I have already on the patient. So it just looks like a pretty simple wound dressing. So what I would start to do is I would want to leave the top pad on. I want to start taking off by the sides, which I want to do with kind of a push and pull, like a push and pull method. So I'm going to push the skin down and I'm going to pull it back because I don't want to irritate that skin. Pushing, pulling, pushing, and pulling. And that side's off. I'm going to do the same thing over here. Kind of push, pull, until that dressing is off on that side. And this dressing came off fairly easily, so I didn't need to use any sterile saline to kind of wet the dressing and be able to pull it off. I'm gonna pull that off, and then I'm gonna, I would throw it away in the proper receptacle. And then the next thing that I would do is, there's some packing in here. It's gonna be soiled, it's gonna be gross, icky. I would, if it was soiled with blood, I would throw it in a biohazard, so proper receptacle. I'm gonna carefully pull this out, make sure the patient's pain's doing okay, and then I would dispose of this in the proper receptacle. Now I would take the time to inspect my wound. I would look at the color, look at any kind of gross, like if it was black or anything around it. So it looks like a pretty clean wound right there in the middle of the thigh, we'll say. It looks nice and clean. It's just looks like a nice healthy wound. It's starting to heal, it looks like. So then before I would get started, I would get the patient into a comfortable position that was for them, and a position that was going to be easy for me to irrigate. So after I would take off my gloves, I would then throw them in the proper receptacle, and I would also perform proper hand hygiene all over again. Then the next thing that I would do is I would prepare for a sterile field. So I already have the patient's wound propped up in a comfortable position for them. I have a drape under them to not soil the bed linens. So then the next thing that I would do with my now clean hands, I would then get my sterile drape ready and prepped. I'm gonna move my tables see a little bit better. The sterile field. There we go. So I have my sterile drape. So the proper way to do this is I would have clean hands. I would, before I open it, double check the date, make sure it's dry and unopened. Then I would check for the expiration date. Everything seems to be in order. So then I would proceed. I would start by peeling back the label, peeling it back the opening. And I will grab the corner of the sterile drape and lifting it high above my sterile field. I'm then going to dispose of the wrapper. I'm only going to be touching the drape by the corners and making sure that it's high up enough that I don't ruin the sterile field. Sure, I'm only grabbing. And there, it's properly open, and then I'm going to walk it down slowly as to not kind of fanfare it open. Okay, now my sterile field is prepped and ready. I'm then going to start adding things to my sterile field. The first thing that I want to do is I'm going to start dropping some of my supplies. I'm going to be adding things to the sterile field. So here I have my 4x4s. Is what I'm going to be using to clean and pack the wound. So I have tape on the sides here, but normally I would peel it back towards me, peel it back towards me. And I would step back and kind of just, I would flip it. So, but for the tape reasons, I'm gonna I'm going to peel back the tape. Because I don't want to cross my sterile field, I'm going to hold it high above and just kind of plop it down. And then I'm going to be using this as my sterile basin for the saline. My tape is just a little small. Bring my chair a little bit closer over here. That way I can use this as my sterile basin and not ruin my sterile field. Okay. The next thing I'm going to do is get my irrigation tray out. Again, double check the expiration date, make sure it's unopened and it's dry. Everything seems to be in order. And same kind of process. Undo the tape here. Okay. I'm going to peel the label back. I'm going to lift it high above my head and drop it. And then I will dispose of this. I'll get my cotton applicators. I'm gonna again peel these back. All of my supplies were used in lab earlier last week. So same thing here, I would peel the label back. I would then turn it to the side, not crossing my sterile field. And drop them. And then dispose of this. I have my sterile saline here, which I'm going to pour into my basin because it's still considered sterile, and as well as the inside of the basin. Okay, so that's filled. I'll make sure that I have my skin preps ready and open. That way I only have to grab them with the one hand. It's ripped and open. And then I'm going to grab my ABD pad, my abdominal pad, which is what I'm going to be using to pack my wound cover my wound today. So again, same process. I'm going to make sure it is dry, unopened, and not expired. So everything checks out. So I'm going to, again, pull the label back and drop it onto my sterile field, making sure to stay high above it, to not cross-contaminate. And then I will get my sterile gloving package. Double checking again, make sure it's not open, it's dry, checking the expiration date. Again, everything checks out. I'll hold it to the side, and I'm then going to peel it back and drop it onto my tray and discard this as needed. And then before I get my sterile gloves ready, I want to everything laid out on my now sterile drape. The next thing I'm going to do, make sure my hands are clean. I've washed them prior to opening the sterile drape and all of my other sterile packages. I'm now going to open up my sterile gloves and proceed to put on my sterile gloves. Our package. And now with my non-dominant hands, I'm going to grab the cuff of my right glove and proceed to so it's not on all the way properly yet, but that's okay. And now with my now sterile glove, I'm going to walk my front fingers into the cuff of my left glove and start putting on this glove. And now I can proceed to push the rest of this glove on. And then I would discard of my package as needed. And now my sterile gloves are on, and now I can proceed on with my sterile wound irrigation and sterile dressing change. Now sterile hands. I'm also going to place a sterile basin under the patient's wound in an attempt to kind of catch any of the fluid. That way we don't, again, ruin her bed or his or her bed. So now what I'm going to do is with my sterile hand, I'm going to grab the piston syringe. I'm going to start irrigating my wound to just a nice gentle flow. I don't want to hurt the patient, so I'm not going to use much pressure, just a light kind of washing it out. Okay. All right, now this is no longer sterile. I will place that down, and now what I'm going to do is I'm going to dry the edges of the wound. So with my sterile hand, I'm going to then hand a clean, I'm going to make a crouton, with my hand, and hand over to my non-sterile hand. I'm going to start drying up top and discard. I'm going to make another crouton and start drying down below. Discard. The patient fell just a little bit. One more crouton. Hand it on, and I'm going to dry right in the middle. Okay, and I will now discard that. Now this would be the proper time to get a wound culture if I needed to. It's nice and it's clean. It's not going to have any overnight bacteria or anything. So if I needed to do a wound culture, that's what I would do now. So now what I'm going to do is I'm going to get ready to start packing my wound. However, first what I want to do is I want to take my skin barrier ointment and I'm going to start drying all the way up top, my skin barrier stuff. Grab another one, start doing down here, and discard that as well. Alrighty, so now with my sterile hand, I am going to now grab this cotton swab and hand it to my non-sterile hand, avoiding to touch the cotton tip. With my still sterile hand, I'm gonna reach over and grab my sterile wet with saline 4x4 and kind of let it unroll a little bit. My hand. Okay. Then what I'm gonna do is we're gonna come over and I'm gonna start kind of feeding it. I would feed, if this was a longer wound, I would then start kind of feeding it in. I would start pushing, and using the gauze and using the cotton swab to kind of pack it properly the right way. That is all packed. Now what I'm going to do is I'm going to take my abdominal pad or my ABD pad. I'm going to cut it to size, and then I would place it on top of the patient's wound. Now I'm no longer sterile with both of my hands. I'm then going to grab tape and I'm going to start taping up the wound. Pieces of the tape. Didn't fall in the basin of water. Okay. And now my patient is all taped up. I would take a final piece of tape, make sure my initials, date, time are on it, and I would put it across the middle of the patient. And that is how you perform a sterile dressing irrigation or wound irrigation dressing change.